Hello everyone, welcome to my YouTube channel, JK the Vlog Canada. I hope you guys are doing well. Well, if you live in Canada, you would know that mostly the medical services here in Canada are absolutely free. So for example, you go to the doctor, you don't have to pay anything from the pocket. In case of hospitalization, there are no charges. Or if you go for, if you go for a blood work, you don't pay anything from your pocket. Except for dental treatment, prescription glasses, or prescription medicine, you need to pay it from your pocket unless you have the coverage from your employer. Okay, so in if you're living in Alberta, I'm going to talk about a benefit where the Alberta government pays for your dental treatment, they pays for your prescription glasses, and they also pays for your prescription medicines. So make sure, if you're living in Alberta, make sure you watch this video from the start till the end. I'm going to explain you how you can apply for this benefit. I'm going to talk about what is the eligibility criteria, how you can apply for this benefit, and if you're approved, you can get a free prescription glasses. You don't need to pay anything from your pocket. You can have your dental treatment done for free, no charges for dental treatment. You can also get prescribed medicines for free. There are no charges at all as well. So make sure you watch this video from the start till the end. Also, if you haven't subscribed to my channel, make sure you go ahead and subscribe to our channel, JKZ Blog Canada.
All right, guys, this is the official website of Province of Alberta. So this is the Government of Alberta's official website. Now, this benefit is called as Alberta Adult Health Benefit. So what exactly this benefit covers? It basically covers your dental care, prescription drugs, eye exam and glasses, essential diabetic supplies, emergency ambulance services, essential over-the-counter medication. So generally, the ambulance services here in Alberta are not free. You need to pay for it from your pocket unless you have coverage through employer. Okay, so if you're living in Alberta, that's one of the criteria. So of course, in order for you to apply for this benefit, you must be living in Alberta. So if you're not living in Alberta, you can apply for this benefit. But let me explain you more about the eligibility requirements, who else can apply for this benefit, and what are the other eligibility requirements, right? So basically, this Alberta Adult Health Benefit Program covers health benefit for Albertans in low-income household who are pregnant or have high ongoing prescription drug needs. So not just a person who's pregnant can apply for this benefit, some other people as well. Like I will explain you who else can apply for this benefit. This health plan also includes children who are 18 or 19 years old if they are living at a home and attending high school. Okay. Now, first of all, let me explain this to you as well. If you have children under the age of 18, you can also apply for Alberta Child Health Benefit Program. That will cover your children as well. And we will go through the application process in the next few minutes. Okay. Now, what exactly it's covering this benefit? It covers dental care services, like I mentioned earlier, but it basically covers basic services like extraction, filling, and dentures. So generally, these services are not free in Alberta or anywhere in Canada. You need to pay from your pocket. It's not usually covered through the provincial government, right, or through the federal government, right? You need to pay it from your pocket. Also, unless you have a coverage through employer. So if you're working, you have the private insurance through employer, or you have a privately purchased insurance plan, then you can use those plans to pay for these services. But generally, it's not covered here in Alberta or anywhere else here in Canada. So this plan actually covers basic services like extraction, filling, and dentures, preventative care like X-ray examination and teeth cleaning are also covered. It also covers eye exam, glasses. So generally for an adult, eye exam and eye glasses are every 2 years. Okay, but for a dependent up to 18 of years of age, it's the glasses, it's like each year. So that's basically the difference. So if you're an adult over 18 years of age, then you will basically, if you're approved, you can only have your eye examination done in every 2 years. And similarly with the glasses, you can have it every 2 years. So after 2 years, if you're still eligible, you can go for another eye testing and you can get another glasses, but it's generally every 2 years for adults. It also covers the prescription drugs, and the list of the eligible prescription drugs can be found here. So this is actually a helpful link. So you can go through this link, type the medication name, or you should be able to find out what medicines are covered. It also covered, and that's another best thing. I really liked it. So I still remember when we moved to Canada 5 years ago, I applied for this benefit. I got approved. And the best thing about this benefit was that we were able to get some multivitamins when my spouse was expecting. So this trust me, this benefit really helped us, and it's a wonderful initiative for the province of Alberta. And if you're eligible, make sure you go and apply for it. Now, your family doctor pharmacist has a list of what is covered until this health benefit plan. So basically, once you're approved, you can go to the pharmacist and you can speak to them, and they can they can file the claim through. They have their own system, and if you're looking for medication, most of the medications are covered most. And if you have any like a specific question, you can just go to the pharmacist and ask them whether or not that medication or that supplement is covered through this through this insurance plan or not, right? And like I mentioned earlier, ambulance services to the nearest hospitals are also covered. Diabetic supplies such as injection supplies, testing strips, and lancets. Trust me, that's one of the other expensive thing here in Canada. So if you don't have any coverage and you're buying supplies, testing strips, and lancet, that costs hundreds of dollars. Okay. Plan member will with diabetic will receive coverage for blood glucose that's straight purchase from a licensed pharmacy up to maximum 3,000 per eligible person, depending on the matter of the diabetic management. So that's basically more about the like that's more about how much you can claim if you have diabetic, right? So of course there is actually a numbers, and they mention up to maximum 3,000 per eligible person, right? So we're not going to go too much into detail, but trust me, this covers pretty much everything. Okay. And now let's talk about the eligibility criteria, because that's very, very important thing. Not everyone everyone here in Alberta would be eligible for this benefit. So let me explain you who would be eligible and how you can apply for it. So basically, you may be eligible if you're pregnant. So if someone is pregnant right now, that's one of the criteria. They can, they would meet this requirement. Or if you're not pregnant, but you have a high ongoing prescription drug need. So, for example, someone has a blood pressure or a hypertensive or high diabetics or diabetics, right? Or if they have any other ongoing prescription drug needs, right? So basically, they can apply for this benefit. And you may be eligible if you're leaving the income support or sure income for severely handicapped ages. So this is basically another program offered for the province of Alberta. So if you're leaving those programs, then you can apply for it to be eligible. In addition to these criteria, um, the other thing is you must live in Alberta. That's something I just mentioned earlier. You must be a Canadian citizen or have permanent resident status here in Canada. So for example, even if you're a newcomer in Canada and you just landed and but you do have a permanent resident status here in Canada, you can still apply for this benefit. Of course, meet the guideline below. You must not be receiving. That's another thing, like they just mentioned above as well. So you must not be receiving health benefit from other government programs like income support, assure income for the severely handicapped, child and youth support program, Canadian government program for First Nation people, Inuit. So these are the other kind of benefits. So just making sure that you're not applying for these benefits or you're not receiving it already, because if you're receiving it, you won't be able to apply for this benefit. Now, the other important eligibility requirement is because it's mainly for the low individual income and low individual people, right? So those who are um, if their income is under that threshold, they can apply for this benefit. So let's talk about the net income. So net income is generally, you can see this information on your notice of assessment from the Canada Revenue Agency. So when you file your taxes, you'll see this line number, line 23600, right? So you need to make sure, if it's a single person, let's say, you're basically applying for yourself, you don't have any family member, you don't have any spouse, no kids, right? Then the income criteria is 16,580. But this would be your net income. Okay. So you look at your net notice of assessment and make that decision whether or not it's a net income. If it's above the threshold, then you won't be eligible, right? Similarly, if it's one adult, one child, the net income is $26,023. If it's one adult, two children, 3110. Then one adult, three children, 36,325. So couple with no children, 23,212. Couple with two children, 36,634. So that's basically what the income requirement is. So if your income is above this threshold, you may not meet the criteria. Okay. And that's basically the explaining how you can calculate your net income, right? Now, so this is pretty much what the criteria is. So as long as you meeting the criteria, let's say you're pregnant or you have an ongoing prescription drug needs, right? Then you can apply for this benefit. And the other important information, like I mentioned, that you may not be claiming these benefits. Also, your income should be under the threshold. So it depending what's your family size is. Accordingly, if your income is under that threshold, then you can apply for this benefit. Now, let's talk about how you can fill the application. Okay. Now, basically, if you look at the application form, so this is the application form. I'll try to attach the link in the description as well. So this is basically the form. So if you're pregnant and you're applying for yourself, you just tick that box. If you're not pregnant, just tick this box, fill out your information. So this would be the information of the applicant, right? And then if you have a spouse or common law partner, so the other thing to let you know, this is clearly mentioned here as well. You need to also enter your Alberta personal health number. Do you have a health coverage other than, so if you have any other private insurances, make sure you do check that box. So do you have an Indian Inuit status? If you do have that status, take that box. Were you born in Canada? Yes. Now, if you were not born in Canada, you will need to attach a proof. Please submit a copy of your Citizenship Immigration Canada documents. So that could be your PR card, your Canadian passport, and all that. Similarly, this will be applicable for your spouse as well. So make sure you enter all the social insurance numbers and all that information, right? And if you do have children under the age of 18, please do add them here as well. So once you're approved, because once you're approved, it will be, the benefits will be, the coverage will be for your kids as well, who are under the age of 18, or whoever you add them in the application, right? And it will also be applicable for your spouse as well. So once you fill this application, just basically you also need to provide your consent here, that you basically authorize or you provide your consent to Alberta Health Services or the government of Alberta to pull your information or to verify your information from Canada Revenue Agency about your taxes, because like I mentioned earlier, this is actually for low income individual. So if your income is too high, you won't be able to apply for this benefit, right? Now, like I mentioned earlier, once the application is filled, you can basically mail this application. Just fill out the application form, mail or fax your complete application to Alberta Community Social Services Health Benefit Contact Center. You can fax it, right? Or and also if you still have concerns or questions, you can call them. Just to let you know, I'm not a financial advisor. I'm not a legal representative. So do not take this as a legal advice or financial advice. Just do your own research. I thought this is kind of a great initiative, and you should also apply for this benefit if you're living in Alberta. So feel free to reach out to me if you have any concerns or questions. I will add this link in the description as well.
You guys, well, thank you very much for watching this video. I hope you like this video about the Alberta Adult Health Benefit. In case if you have any questions, just leave it in the comment section for me. I'll try my best to respond to you as soon as possible. Well, thank you very much once again for watching this video, and I hope to see you in the next vlog very soon. Thank you very much. Take care. Bye-bye.